Okay, thank you very much. Thank you for giving us the opportunity to present you what Ciber BBN is. This is a virtual research center which was launched in Spain in 2006, November 2006. Actually, there was 9 different cybers launched at that time in Spain for different diseases. This is the only one who is mainly focused into bioengineering, biomaterials, and nanomedicine fields. The main mission of Ciber BBN is to foster high quality of research. This is obvious, but we would like to focus mainly in translational projects. We are health-oriented institution. Obviously, we have in mind the importance of being capable of transfer our research results to the industry. So we are very much in touch with some of the most important companies in Spain. So we would like to develop and to perform these projects, being capable of putting together the translationability of these projects, to be sure that they fulfill unmet clinical needs, and also that they can be effectively transferred to the industry if time comes. This is being achieved through different scientific research and horizontal programs that I will just depict very briefly, not to bore you. Let me, before, just give you a hint of which are the main reasons that makes Ciber a good initiative in Spain. Well, it's obvious that the biomedical technologies have a very important weight in the biomedical field. We wanted to have an institution that was capable of being very well aligned with European priorities, capable of setting up those programs mainly based on what was being cooked at the European level. Obviously, increased translational, which is one of the main focus of Ciber, mainly to the clinics. Increased transfer, track resources, optimize our resources. You have to keep in mind that Ciber has at this time like around 25 different institutions around the country. This gives us a good chance to increase very much everyone's capabilities in terms of technologies and research capabilities than before Ciber exists. We would like to favor the emergence of well-trained scientists. This is one of the things that we are also doing. So there's a bunch, there's a part of Ciber which is taking care of all the academic part and training of specialists. Why? Because we have people inside Ciber coming from different fields of research. This is a multidisciplinary Ciber, meaning that we have people experts in the biomedical field, but also in mathematics, in physics, chemists, computer science, biomaterials, implants, well, clinicians, you mentioned. But the idea is that we have to also to train people expert in what's nanomedicine and also some other fields related to bioengineering and biomaterials. Probably I would say that the last one of these headings to me is the more important one. This is the interdisciplinarity. This is what gives us the capabilities of doing RD projects which were impossible before Ciber exists, or let's not say impossible, but very, very difficult. This is just a picture of how our research groups are being distributed geographically around Spain. There was around 400 or 500, I don't recall, 400 or 500 different groups were applied for becoming groups of Ciber. So there was a very big, strict process of selection of those groups. So in terms of being sure that only those ones showing some special excellence and capabilities for the Ciber were chosen. Something interesting is to see. Do I have a laser point here? Yeah. Oh, this one. Okay. So this is probably one of the things that I think it's more interesting in cyber. Although most of the groups are coming from the university field, from the universities, something interesting is that we have been capable of gathering also hospitals within our structure, which is a real achievement in this field. These 7 hospitals, I have to say, that are some of the biggest hospital complexes in Spain, and this gives us the opportunity to develop projects and programs very well advised under the clinical point of view. So we have a special medical advisory board on cyber too, who also give us advisement about which are those unmet clinical needs that we have to address, and also special management teams in charge of the IP issues and transfer issues, which is, as we have been seeing during the whole day, very, very important. Our scientific plan is devoted to transnational research. We have here agreements with other cyber hospitals and clinical institutions to support also clinical trials and mobility between hospitals and the groups of cyber and vice versa. Technology transfer program, which is the one who is mainly focused in IP issues and also in RD projects which are being developed with the industry. Here we have all these programs encouraging the obtention of patents and creation of spin-offs. I have to say that, just as a model of example, that Cyber issue around 40 different patents in 2009, and we're expecting to have something similar in 2010. So it means that this is an important part of cyber. Training, as I was saying, and also these 2 here, which I will develop a little bit further, which are the equipment and infrastructures and the intermodal research that we're performing. For what concerns equipment and infrastructures, we have at this time 5 big technological platforms. Those are the production of biomolecules platform, this here, the production of biomaterials and nanoparticles, tissue biomaterial surface characterization, bioimaging and validation, and high-performance computing. Those are the big platforms that we have. This is a list of the special facilities that we have in every one of each. So this is around, I don't recall the name, but probably around 20 different facilities. Those are very well equipped and expert and very, very good in terms of expertise facilities, which are being well, I can provide you a list of these facilities if you're interested into collaborating with them. I would like to mention these 2 here, because the 2 ones that we have in some of these huge hospitals, those are facilities mainly devoted to toxicity studies and in vivo, in vitro validation. There's also a bunch of them also concerning, well, as you can see, from microelectronics, nanoelectronics, nanolithography, biodisposition materials, tissue scaffolds, engineering, production of protein platforms. There's a bunch of platforms that are fully functional now, and I would say that all of them are involved in some point in most of our research projects and programs. For what concerns the intramural research, we have 3 different programs and 6 strategic research lines. Those here, the bioengineering program focusing to these 2 strategic lines. One is the multimodal diagnosis, which is focused into molecular imaging and multimodal imaging and functional tissue modeling and integration. The intelligent device line, which is focused mainly in the obtention and development of new portable and friendly user devices, and we're actually working for a bunch of different types of diseases. Probably those ones listed here are the most important ones, but we're not just limited to those ones. That's the message, no? Obviously, diabetes, cardiovascular diseases, neurological diseases, cancer, and other rare diseases and chronic pathologies are something which is very interesting to cyber. We have the other program, which is the biomaterials program, also with 2 strategic research lines. The regenerative medicine, which is one devoted to the improvement and regeneration of cells, tissue, and organs, working with stem cells, new scaffolds, etc. The implant research line, which is devoted to new generation of implants based on patient needs. And the nanomedicine area, which is the one I'm coordinating, which also has two different strategic lines. One is the biosensors and molecular diagnosis line, mainly biosensor and specific biomarkers detection for the clinicals, for the clinics, and also therapeutic nanoconjugates and new drug release systems, new drug delivery systems, which is also devoted to the obtention of drug delivery systems in different diseases. Just to finish, I'm going to show you very briefly three of the projects that have been running on Ciber at this time. We have, I have to say, more than 30 projects running on. Some of them, a high percentage of them, I would say, are being developed with other institutions, foreign institutions, and colleagues from other countries. So one of these projects is the NanoStem project based on drug delivery system for cancer stem cells. This is one of the projects that was approved in the last EuroNanomed call in 2009, excuse me, not in the last one, in 2009. This is an example of one of the projects which you can find in the biomaterials program. It's devoted to develop new scaffoldings and cell cultures for regenerative medicine, and we're treating vascular diseases, biodegradable and bioabsorbable polymeric systems, soft tissue, biocompatible polymers to guide therapeutic agents in a mesh of polypropylene with controlled release, for instance, cartilage, bone, eye, and specifically in the eye section, we are obtaining several biopolymers. We have a very potential substrate for liver niche stem cells, which is working pretty well, I would say. For what concerns the nanomedicine area, I'm just showing you the type of projects that we're doing in the biosensors line. We're developing a series of biosensors, different types of biosensors, in order to provide nice diagnostic platforms for different types of samples, biological fluids, for diagnosing infectious disease in hospitals, clinical laboratories, point-of-care tools. These all are points which are being developed in different projects. And also, just to finish, in the nanomedicine, the therapeutic nanoconjugates line, in which we are developing those drug delivery systems and are trying to potentiate very much toxicological studies and in vitro and in vivo validation models. So this is my last one. The message I would like to send you is that we are very open to any kind of collaboration. There's more than 400 professionals now within Ciber, so please, if you have new ideas, if you just want to contact us, just please feel free and contact Ciber directly or myself. Thank you very much.